In this morning's Health Watch, the alarming rate of diabetes. A new study finds the number of adults around the world living with the disease has more than doubled in the past 30 years. Medical correspondent Dr. Jennifer Ashton has more on this epidemic for us this morning. Doc, good morning.
Good morning to you, Chris. In the U.S. alone, experts predict that more than half the adult population will be dealing with some form of diabetes by the year 2020. And while some cases are tied to family history, many more are tied to obesity and unhealthy lifestyle choices.
3 years ago, 32-year-old Gwen Seaton began feeling exhausted after almost every meal. When she went to her doctor, a routine blood test quickly diagnosed her problem as diabetes.
I was actually quite shocked when I got it as young as I did. Usually it's a later onset disease in my family.
Seaton was at high risk for diabetes because of her family history. Now she must follow strict dietary rules, take insulin injections, and test her blood sugar level up to 7 times a day, all to make sure her diabetes is kept under control.
It gets frustrating. It's a constant consideration. It's not impossible to deal with, but it is something that you always have to be mindful of.
A new study indicates that more people than ever before are now living with the debilitating disease. In 1980, an estimated 153 million people were living with diabetes. In 2010, that number more than doubled, jumping to 347 million.
The most likely explanations have to do with poorer lifestyle habits of most of us, in that we're exercising less than we should be and eating more than we should be.
But there is some good news for people like Gwen Seaton who have learned to manage their diabetes. Better treatments and early intervention have helped extend the life expectancy of those living with the disease by almost 15 years.
So, Doc, let me ask you, what's responsible for these high numbers? I mean, is it obesity or are there other factors involved?
Well, worldwide, Chris, obesity is the major reason people are eating more and they're moving less. But there are other factors that people need to know about that do put them at higher risk for diabetes. Certainly, your family history is also a significant one. Certain ethnic groups, for example, Asian people, African Americans, are at higher risk. Women with something called polycystic ovarian syndrome or who have had diabetes during pregnancy are at increased risk. And even people on certain types of medication, statins that lower blood pressure, lower cholesterol, high doses of those can be associated with an increased risk of diabetes, and even antidepressants, some of those can increase the risk as well.
Let's clear up any confusion. The difference between type 1 and type 2 diabetes is?
Type 1 diabetes is really an autoimmune disease. You don't make enough insulin. The majority of people, over 90% of diabetics, have type 2, where you make insulin, but just not enough. And that is what is closely related, although not completely, to obesity.
Okay, now as far as the symptoms of diabetes, things that people need to be on the lookout for.
Well, the biggest thing, Chris, is that so many people with diabetes are unaware that they have it. So they should ask their doctor if routine blood testing would be appropriate for them every year. You don't have to be fasting to get this blood test. It's called an A1C. But in general, the big symptoms of diabetes, excessive thirst, frequent urination, or unexplained weight loss are the big ones. But you can have non-healing wounds or sores. You really want to ask your doctor if anything seems out of the ordinary to you.
And as far as prevention, are there things, any measures, effective measures people can take to avoid it?
Well, we say it again and again because it is so important. Lifestyle choices, behavioral issues are key. So you want to eat a healthful diet. You want to exercise as much as possible because we know that, again, as the obesity rates go up, so have the diabetes incidence worldwide. So those things are critically important. And then again, if you know you're at high risk and you have any of these risk factors, you want to aggressively try to modify them, even if it involves switching certain types of medications.
And if you're not at high risk, you're definitely not immune. I mean, it can happen to anyone at any point,
That's correct.
Right?
And I tell my patients we should all consider ourselves potentially at risk for diabetes.
Okay. Dr. Jennifer Ashton, thanks. Good to see you.